Good afternoon. My name is Ethan Tia. I'm a UNSW Psych undergrad, and today I'll be presenting my research poster on exploring the use of ketamine as a pharmacological model of the negative symptoms of schizophrenia. So without further ado, let's get straight into it. Um, Schizophrenia is a psychiatric condition characterized by heterogeneous constellations of positive, negative, and disorganized symptoms. Negative symptoms are a core aspect of the pathophysiology of this disorder, which can greatly reduce the functional outcome of a patient. The exigency to address the negative symptoms of schizophrenia has been exacerbated by the lack of a suitable animal model to mimic these behavioral abnormalities. Research into the etiology and psychopharmacology of schizophrenia has yielded efficacious antipsychotic medications to reduce the positive symptoms. However, the negative symptoms remain largely undertreated and pose a growing medical need. So a valid translational model is needed to facilitate research in the reduction of negative symptoms in patients, as up to 60% of patients suffer with a lack of insight into these symptoms. The study by Chindo et al. Builds on prior literature by exploring ketamine as a pharmacological neuromanipulator to induce symptoms of schizophrenia across all three types, particularly of negative symptoms. In the experiment by Chindo et al., the researchers conducted a forced swim test on rats dosed on ketamine, and they examined their movements, their escape-related movements and immobility time when placed in an inescapable glass cylinder filled with water such that their feet may not touch the ground. The results show that there was an enhanced immobility time lasting up to 21 days after the treatment, after the drug withdrawal. These findings bolster previous studies on ketamine-induced behavioral changes, which align with the negative symptoms of schizophrenia, i.e. depression and avolition. Further study of this animal model relative to other negative symptoms of schizophrenia is recommended. Thus, this proposed study examines the predictive validity of ketamine-induced anhedonia in the sucrose preference test, the SPT. It aims to bolster the use of ketamine as a pharmacological model of the negative symptoms of schizophrenia. It is hypothesized that subjects responding to the ketamine treatment will have a reduced sucrose preference compared to the control group, who will be injected with a water solution, which has a non-effect. Now, hopping straight into the method, let's first start by defining anhedonia. Anhedonia is defined as the reduced capacity to experience pleasure, a common symptom of schizophrenia. Of course, mice who have a natural affinity for sweet items are suitable animals to model this pleasure deficit. This test will place mice in an operant chamber containing two different tubes with a lichometer system attached. One tube contains water and the other tube contains 1 to 2% sucrose solution. And preference to the solution will be the behavioral measure, which is defined as the number of licks for the sucrose tube over the number of total licks. Before any testing commences, there will be a housing and acclimation period of 7 days, facilitating the psychological, physiological, and nutritional stabilization of the mice. They will be kept in regular circumstances with respect to temperature, humidity, and light and dark cycles, with the light on cycles beginning at 6 a.m. And they'll be kept in clear plastic cages with wood shavings. Following a between subjects design, all mice will be put through an initial phase of the SPT, and a day later, on day 8, from days 9 to 13, the ketamine treatment will be administered to half of the mice in 5 repeat subanesthetic doses, 30 milligrams per kilogram. And these 5 doses will be spaced each 1 day apart. The other half of the mice will be injected with a water solution, the control group, of course, at the same frequency and period. Following this, all mice are tested for their sucrose preference after the 5 iterations on day 1, day 7, day 14, and day 21 post-treatment. The SPTs will be conducted during the light period between 8 a.m. and 2 p.m. Now moving on to the results. It is expected that the hedonic deficit will be clear for the post-ketamine treatment compared to the initial group, the initial SPT, sorry, and the control group. This reduction in sucrose preference can be interpreted as anhedonia, less sucrose leaks, as well as avolition, less leaks overall. You can see this in table 1. A reduction in sucrose preference is also expected to persist for all time periods post-treatment. This is expected to be in contrast with the control group, whose leak frequency and sucrose preference should be relatively constant relative to the initial SPT. You can see this in table 2. Moving on to our figures. In figure 1, we can see the sustained anhedonic behavior displayed by the ketamine-treated group compared to the control group. Over the 21 days post-treatment, the ketamine group exhibited less reward-seeking behavior through the lesser leaks overall, as well as less leaks of the pleasurable sucrose tube. And in figure 2, it dives a bit deeper, depicting the average number of leaks after treatment for the control and ketamine group. There is a significant decrease, as you can see, in the total average number of leaks throughout the 2-hour testing period for the ketamine-treated groups, even up to 3 weeks post-treatment. Let's move on to the discussion. Apologies for that. So the hedonic deficit displayed by the treatment group compared to the control group lends more predictive validity to the animal model of schizophrenia. Carlson and Mogadam have proposed that the negative symptoms of schizophrenia may be elicited by alterations in the dopaminergic and glutamatergic functions in the prefrontal cortex. This has been observed through a study of the NMDA receptor antagonists such as ketamine and PCP, which interfere with glutamatergic activity in frontocortical areas to then elicit dopaminergic hyperactivity. According to the glutamatergic hypothesis, the non-competitive antagonists bind to the NMDA receptors, which incite behavioral abnormalities mimicking the positive and negative symptoms of schizophrenia in animals. This is supported by lesion studies to the PFC in humans, as well as chronic PCP abuse in humans, inducing symptoms closely resembling that of negative symptoms of schizophrenia. Studies from Olney et al. And Metri et al. Have also shed more light on the lower density of glutamatergic receptors in the brains of schizophrenic patients. The sustained anhedonic behaviors of from the mice, even up to 3 weeks following treatment in this study, may be tracked to the study from Becker et al., who found that even after 4 weeks of ketamine treatment in rats, glutamate binding was significantly decreased in the frontal cortex. Therefore, using ketamine as a pharmacological model of the negative symptoms of schizophrenia is supported by the findings of this study. These findings will provide further insight and potentially strengthen the ketamine-induced behavioral changes of this animal model of schizophrenia. This may facilitate a breakthrough of the current limitations that exist in understanding and treating the negative symptoms. A follow-up study pairing this methodology with novel antipsychotics to alleviate these symptoms can gauge efficacies. It is also important to note that the differences in sucrose consumption may vary according to numerous factors such as water and food deprivation and individual animal sucrose preferences, although we've done what we can to minimize that. And a study from Wolf et al. Has shown no evidence for behavioral differences in sex in regards to sucrose preference. However, any minimal differences which may exist, this study does not factor that in. Further study into other negative symptoms, as well as and novel pharmacological treatments, as well as neuropathological studies of ketamine treatments, would shed more light on this model. Moreover, studies exploring the relationship between ketamine and other negative symptoms of schizophrenia, i.e. social withdrawal, avolition, and affective flattening, would be recommended. Thank you so much for your time. These are my references. Thank you.